right, folks, we've been talking about the coronavirus in terms of where we are. More than 100,000 now confirmed cases in the United States, more than any other country in the world. Some people are saying, though, we're going to be reaching our peak in a couple of weeks. Joining us right now is Dr. Cindy Duke. She is a virologist, and we're certainly glad to have her here. Doc, how you doing?
I'm good. How are you?
All right, so let's talk about this here, because I'm reading all these stories and I'm hearing people saying that we're gonna reach this peak by April 1st. Some people, matter of fact, I've gotten text messages from people who said that because of the symptoms and when they reach their point that we really, matter of fact, let me find it right now. Let me find the tweet that I got, the text that I got earlier that I found to be actually quite interesting. And according to this, it says from March 23rd to April 3rd, we're going to be at the peak of the virus because of when this thing began to spread, when people initially got infected, and then the symptoms begin to build. And so give us a sense of where we're going right now based upon the data that you see.
Yes, I think unfortunately it's unlikely that there will be a peak in the next week, and that's only because we haven't actually restricted spread. We haven't achieved containment, right? And so in order to have containment and therefore a peak and then a fall, so in order to plateau, you first have to contain the virus, meaning stop spreading it. And in order to do that, you really have to stop people, restrict travel, really stop the interaction, the social interaction. And at this point, about half of the country is doing that, but the other half is not. And that's the problem. And so although I would love to be able to tell everyone here right now that we will in fact have a peak in a, that's not true, because more and more new people are being infected. If you follow the data coming out of Johns Hopkins University School of Engineering, where they've been tracking the infections across the country, the infection is actually spreading in cities across the country, outside of Washington State, New York State, or California. You're actually seeing higher and higher numbers in terms of infected people. Keep in mind, right, 100,000 cases in the United States, about 40,000 are in New York City. The other 60,000 are in other states, and we're barely testing people. There are lots of people who are at home with symptoms, but because the testing isn't available, they've been told to stay home, right? And so, no, I actually think our numbers aren't truly reflecting the gravity of what's going on right now.
See, that's the thing. I want to bring in Quadricos and Robert. Y'all have any questions for the doctor? That's the thing, Doc, that I don't understand here. That you have Trump and all the people talking about, how we're, we're achieving the tail end of this. And I'm sitting there going, but I'm looking at cases in Mississippi. In fact, Ashton Pittman is a reporter in Mississippi, and he posted something earlier, a particular tweet that I found to be very interesting that showed how this thing has been moving and escalating in Mississippi. And it's been a steady increase. And again, you're hearing all of these people say, oh, no. There's these wonderful reports from the White House, yet you're seeing how it's moving in other places. I'm confused here.
Yes, and that's the truth. I actually had the pleasure of being on a summit last night, a summit call with doctors from China, Italy, and other countries, and they all really pointed out that if you don't restrict travel, the virus will spread. For example, as you probably heard today, the governor of Florida has finally announced that people arriving from New York State, for example, will need to go into quarantine if they're in Florida. Because the truth is, a lot of people, let's use New York as an example, have left New York in an attempt to escape the worst case of the virus. However, most people with the virus are asymptomatic, which means that they're probably now taking it to other states. And so until that is under control, all that's happened is the virus is spreading. It's what happened in Italy when they announced when it was leaked that Northern Italy was going to shut down. People left in mass exodus, and that's how it spread across Italy. And right now, that is what's happening. We haven't restricted interstate travel. People are moving from the hardest hit areas currently to other areas. So what we're going to see is new focus points, hotspots, and we're seeing it on the map as you watch closely daily. Every city, every state is reporting higher numbers. So we're not peaking yet. We're not even plateauing yet.
I'm going to go to a question from Quadricos and Robert, but while we're setting that up, I'm going to, this is a map from the folks at 538. And they're showing the spread of these cases all across the country. And they're saying that you're seeing more cases right now in blue states, but it's spreading in red states. Robert, you're in Georgia. You certainly see what is happening there. What's your question for Dr. Duke?
Well, no, that's exactly my question, because one of the hot spots we have in Georgia is, one is Albany, Georgia, which is a rural area, and also Carrollton, Georgia, which is a rural area. As this virus works its way into red state America, places that are more sparsely populated, however, that also have much weaker healthcare infrastructure, how can we prevent the sharp curve that we've all been warning for? We are in areas that have rural healthcare systems that cannot handle ventilators, which cannot handle a massive influx of patients coming in, the way that a big city like New York or San Francisco or even Atlanta will be able to.
That we learn lessons from the other countries who have been affected. I think what's unfortunate, so far we haven't really used the opportunity that we've been granted, which is we're one of the last countries to really be hit by this. So would see what other people were doing well and weren't doing well. And what you know is, even for rural places, you have to have a triage system in place. And in order to triage, you need testing. And so we're lagging behind in testing in two ways. We don't have enough tests, and we certainly don't have enough rapid tests. We need to be able to test and identify people right away, put people in quarantine, put people in isolation. There's a difference between quarantine and isolation versus those who need to be hospitalized or moved, if you're in a rural setting, to a city or a hospital system that has the that we need. And so I think that has not quite well been messaged out there. And it's not uniform across states, that's for sure. And it's certainly not something that's well understood amongst the everyday person. And we need to do a better job with that, because it's important. It's the only way we can stop spread, whether it be in a rural area or not. We can't pray for summer. No proof that this virus would really go away in summer. We can't just rely on the idea that maybe some of us are immune or herd immunity. That is not the case right now. We need to do better at containing, meaning stopping spread.
Quadricos, you got a question for the doc?
Two questions, Doc. The questions I've been receiving a lot. First question is this thing airborne? And the second question is, how long does one have to be in the presence of someone who is infected to be infected?
Yes. Is it airborne? Not in the sense that people presume airborne to mean. So first of all, viruses are not alive. So it's not like it's living and out there breathing or getting energy. Viruses are particles. They're not alive. They're technically inanimate. But they can hang in moisture droplets for a couple hours, 2 to 3 hours. And certainly if you're within less than 6 foot space from someone, droplets pass between people. And so air droplets can have particles. So that's the first question. Is it not exactly, but it can be in air, yes. And if you have a single isolated circulating system, like say an airplane, etc., it can pass around because the air is only one source moving throughout the plane, etc. And your second question was, I'm sorry, can you repeat the second question?
How long does one have to be in the presence or the company of another person who is infected in order for them to be affected?
Yes. You know, what's amazing, it's not long at all. And so some of the papers coming out of China show that people who just sat next to other people on a subway became infected. It's just a matter of viral load, being exposed to a bolus, as we call it, a virus. And you may only have maybe shaken hands with someone and didn't clean your hands after, or you sat next to someone for, right next to someone for a few minutes, but it may be enough to expose you, particularly if you have underlying immunocompromised state, meaning your underlying health isn't the best for its immune system. And also if you're having repeated short exposure, as we're seeing with healthcare workers, they may not spend a very long time with any individual who's infected, but repeated exposure absolutely further worsens your chances.
All right, Dr. Cindy Duke. Actually, my final question for you, Dr. Duke, your specialty is fertility.
Yes, sir.
For women out there who are looking to get pregnant, women who have already gotten pregnant, what precautions should they be taking with this coronavirus?
At this current point, we have no specific pregnancy precautions, as in to say don't attempt pregnancy. Although for fertility clinics, we've been guided to hold back on getting people pregnant. That said, if someone is pregnant, we know that pregnancy can predispose women to certain infections sometimes. And we know that not necessarily from this coronavirus, but other coronaviruses, if they cause a really bad fever, it can lead to miscarriage, etc. So for women who are pregnant, the recommendation is to really, really practice social distancing, hand washing, sanitizing, cleaning spaces. And also, if you're pregnant and working in a high-risk area, the recommendation from the CDC, for example, for pregnant healthcare workers is to avoid direct patient contact.
All right. Doctor, we certainly appreciate it. Thanks a lot.
Thank you. Thank you for having me.
All right. Thank you very much. Again, that's Dr. Duke. She's out of Las Vegas, a virology expert. You see why we got to have these black experts? All right, Robert Quadricos, I don't know about y'all. After the first week being at home, I gained 7 pounds. I was like, oh, hell no. Changed the diet and exercise, dropped 4 in the last 2 days. Going to lose another 2 by tomorrow.